If you're ready to unlock more better days, to take control of your health, to push past your limits and unleash your full potential, then you're in the right place. I'm your host, Dr. Jeremy Bettel. For over 2 decades, I've worked with elite athletes and high performers, helping them optimize their bodies, strengthen their minds, and recover from setbacks. Now I'm bringing that expertise to you through the Vitality Collective podcast. In each episode, we'll dive deep into the science, strategies, and real-world solutions you can apply right away. Whether it's enhancing your physical performance, avoiding or recovering from injury, sharpening your mental edge, or simply feeling your best every single day. With insights from top experts and thought leaders, this podcast is designed to help you take action, feel better, and live the life that you deserve. Welcome to the Vitality Collective podcast, where every day is vital. Today, I'm joined by my co-host, Michelle Bettel. In this episode, we talk about injury prevention and why avoiding frailty is the foundation of long-term vitality. We cover how to assess your current capacity, prepare for the demands of your favorite activities, and apply the same principles used in professional sports to everyday life. If you want to keep moving well, stay injury-free, and feel strong at any age, this conversation's for you. Let's get into it. Today, I am once again joined by my co-host, Michelle Bettel. Michelle, welcome back.
Thank you.
You look very excited to be here.
I'm excited to be here. Thank you.
Excellent. Well, today we're going to be talking about what I believe is probably the most important topic in longevity and certainly in vitality in terms of your quality of life. So it's often said that cardiovascular training adds years to your life, whereas weight training adds life to your years. And so what we're going to talk today about is a little bit around that weight training, but as it pertains to injury prevention and avoiding frailty. For me, avoiding frailty has to be our number one goal in our longevity program. And it's what will give us access to all of these other things that we try and do that will ultimately help our performance, help us stay active, and then help us live longer, better lives. So I'm going to turn the questions over to Michelle. I'm going to take the guest seat today. So Michelle, fire away.
I will. We are so excited about this conversation. You and I have had multiple conversations before this, so I'm excited to share it with everyone. Let's start with what makes you qualified to talk about injury prevention.
Yeah, good question. And an important one. So throughout my career, I viewed injury prevention in sport as sort of the number one requirement of my role as initially a strength and conditioning coach and then as a performance director. The premise there being if our players were available, we were going to be a better team, right? Every coach is better when their best players are actually playing the game. So what I did in my programming was actually set about analyzing the sport, analyzing the players, and really discovering what were their susceptibilities to injury. And started that from early in my career, and then went on to build these systems, firstly with the Toronto Maple Leafs, where we built a system around the athletes, where we initially looked to decrease injuries, but we ended up going 3.5 years without having a single injury, which hadn't been done in professional sport prior to that. So something that I'm immensely passionate about and really proud of the results that I've been able to create as a part of these organizations with an amazing staff to help sort of build those systems and create the results.
It seems obvious to me that you see injuries very differently than a lot of practitioners. So tell me how you see it differently. How do you look at it?
So multifaceted, for one, but I don't think as complicated as we can make it. Mm-hmm. I think the number one underlying principle in preventing an injury is understanding that injuries happen whenever we exceed our capacity, right? And those capacities in sport really are, for me, related to what are the demands of the sport. And so They are force specific. They are conditioning specific. How fit are you cardiovascularly? They're direction specific and also velocity specific. So how fast are you asking the muscles to contract? Once we sort of understood that, we could then start really diving into what are the risk factors that would leave an athlete to be susceptible to those injuries. Tying all of that into where the athlete currently stands, what are their current capacities? What are they going to be asked to do? And those susceptibilities give us the path to sort of connect those two and raise the athlete's capacities to meet the demands of the sport they're going to be playing. And it's an ongoing process of continually monitoring to make sure your athletes are at that capacity throughout a season or over the span of their careers. So it's a constantly iterating process. I think the more traditional view of it, athletes come into camp at the start of training camp and we test them and we do our performance testing. How strong are they? How fast are they? How high can they jump? How fit are they? And then once we've got all that, we just start the season and we don't test them again until the next year. So there's a massive lag. After about 6 weeks, none of that initial testing actually means anything.
And this is traditionally, that's not actually how you did it. Mm-hmm.
That's correct. Yeah. Mm-hmm. And so in that traditional setting, you sort of have these timestamps of the player year on year, mm-hmm. but you don't really know what's going on in between. And so it's really important to be a little more granular with assessing the athlete so you can consistently iterate on what it is that you're trying to achieve with the athlete.
Yes. And before we get too deep into that, let me back up a little bit. Can you just draw a parallel between your pro athletes and the everyday person that we're working with now? What we hear a lot is, well, I'm not a pro athlete, so why do I need to do this?
Yeah, I think it's such an important parallel to make, and it's why we've started Vitality Collective, ultimately. Mm-hmm. When I left sport, I saw people in a lot of pain. I saw people dropping out of the sports that they loved playing. I saw people getting injured and never quite being the same. Mm-hmm. And so it became really clear that strategy of training for the demands of what we want to do was just not in place for most regular people. Mm-hmm. There's a thought often that playing your sport is enough. So they just play golf every day. And that's fine until things start breaking down because you've not built the structures that are needed to produce those high force in rotation. Mm-hmm. Similarly, you see people going right out onto the pickleball court and there's a huge spike in injuries, torn Achilles, torn hamstrings, mm-hmm. quads, because they're not prepared for that level of intensity that is going to allow them to perform pain-free.
Mm-hmm. We've talked previously about how injuries don't just happen. There's a lot of people that think injuries are inevitable. There are a lot of practitioners that think mm-hmm. injuries are inevitable. But in your experience, you know that they don't just happen mm-hmm. and they're not a mystery to an experienced practitioner. Can you tell me more about that?
Yeah, I think it goes back to looking at those demands and really understanding what are the risk factors for injury. You can go very granular on what are the risk factors within a certain sport. If you're preparing for a sport, you can look up all the research on what are the documented risk factors. And so there are predictors, there are signposts along the way that would increase your susceptibility. I'm not going to say predict because it's such a chaotic environment. You never know if there's going to be an injury, but you can certainly say that somebody is susceptible to an injury. Mm-hmm. And you've got to be really conscious of that as you guide the athlete through the programming as to where they might be susceptible and how you're going to close that gap. So it's not just that an injury comes out of the blue. It only comes out of the blue if you don't know where the athlete is relative to the demands of the game. Mm-hmm. And we found that when we went from testing an athlete after they were hurt to return to play,
to testing them before the injury when they were healthy, what we found over here when we really started to look at pre-injury was about 50% of our healthy athletes who were playing at elite levels in the NHL were actually not capable of passing the criteria to return to play from injury. Mm-hmm. And so you would never have known until the injury happened. And that's sort of been the prevailing thought in sport, right? They're healthy, they're fine. And then they get hurt. And well, there was no way we could have called that. Well, there is if you test them. If you know that there's a relative strength level, that if they drop below that threshold, they're susceptible to a groin injury, and your athlete has been decreasing over the course of the season, we now know that they are susceptible to an injury. And if we consistently over time exceed their capacity, then they're a ticking time bomb. It's a matter of time before we see that injury come up. So it's not really a surprise. It could have been detected.
Mm-hmm. And I'd like to just sort of emphasize here that we're saying athlete a lot, and you've already drawn the comparison, the parallel. Mm-hmm. So this applies to everyone, no matter your age, if you're a youth, playing or not playing, through college, athlete, non-athlete, midlife, even into your older years. This applies across the board.
Exactly right.
Yeah.
Because while the output might look a little different, you might not be going to play in an NBA game or an NHL game. You might be going out on a Sunday to play in a pickleball tournament. Mm-hmm. But those demands are still being placed on your body. Mm-hmm. You still have to ask your muscles to respond to an incredibly fast deceleration and change of direction. And so while the level might be different, the risk factor is still the same. Mm-hmm. And if anything, you are at more risk because the only thing you do is your sport. You don't prepare for it. Mm-hmm. And so with the athletes, we're doing a lot of preparation. It's just performance. It's the same human system performing the same tasks. One of them has a 60-inch vertical jump and the other doesn't. So you've still got to be able to prepare to perform the task at your maximum ability, because sport is very unconscious. It's why it's actually so good for longevity to play pickleball, because it's a very reactive environment. It forces you to be able to stop and start and decelerate and accelerate. Mm-hmm. And it's the reactive nature of it makes it an excellent longevity activity for fall prevention. Mm-hmm. And so it's important to do, but because it's unconscious, you're going to perform tasks very, very quickly and unconsciously. And so that's going to put a much higher load on the system in terms of the forces you're going to produce stopping and starting.
So we've talked about activities that I think people will very quickly associate with demands being placed on their body, like pickleball, golf, hiking. You work with some people that have different demands on their body that a lot of people wouldn't associate in this way. So they have to stand a lot, they have to sit a lot, they're on long flights, they have to think a lot. We call these people cognitive athletes. Will you talk about those demands and how this applies?
Yeah, sitting is one of the hardest things you can do on your body. You know, so many people report back pain when they have to sit for a long time. That pain in the very high hamstring, almost like right under your butt. If you think about the architecture of that area, that's where all of the forces come through, and those hamstring tendons attach right where you're going to be sitting on them. So you end up compressing that tendon all day, really limiting its blood flow, creating a lot of friction within that area, which leads to inflammation and tendinopathies. And it can be incredibly painful. Mm-hmm. So we have to be conscious of that. If you're going to be sitting a lot, maintaining really strong core musculature, really working on that high hamstring and the glutes to make sure that they continue to get blood flow, that they continue to be really strong, and we can actually start to train them out of a tendinopathy sort of response. Once those set in and become really chronic, it can be very, very stubborn and take a long time to train out of them. And so that's a huge demand that's being played on your body that's really unavoidable, because you can't necessarily move from that seat. If you're in a profession where you've got to be locked in for 3-4 hours at a time at your screen, and there's big money riding on your decisions and your performance there, you can't just get up and stretch, right? You can't miss something. And that requires you to prepare for that.
So
and then
there's
you
a
alluded
demand
to
there.
yes, exactly. There's a physical demand on the body, even though you look quite sedentary. And the thing with back pain is your back just hates being in any one position for a long period of time. And so what we need to do is prepare your core musculature to maintain your posture. If you sit for a long time and round your back, we start getting compression on the lower lumbar vertebrae and on the discs. And that's where a lot of that pain can come from. We see a lot of sciatica. We see a lot of lower back pain resulting from that. And so we've got to train those muscles in the back and in the core to be able to maintain a good posture over an extended period of time. We've also got to train awareness in this regard. None of us maintain good posture all the time, but we have to have that meditative check-in, catch ourselves not sitting right, catch ourselves not breathing, and actually adjust and sit up. So there's a lot that goes into sitting at a desk all day. It's very, very demanding on the body, very, very challenging, and can lead to a ton of different pain patterns coming up. And that sort of leads me into something that's really a key principle in how we start, right? I think that's really important to take somebody, like, how do we do that journey? So I think that the first part of that is, who should you go and see? Right, there's all these qualifications out there. There's all this stuff floating around on who's the best person for a certain thing. So on that spectrum of care, you've got your MDs taking care of your medical health. You've got physical therapists, maybe some athletic trainers who are in that sort of rehab type realm. And then we keep progressing down the intensity spectrum, and we've got our personal trainers and our strength and conditioning coaches, and then sometimes our sports coaches can be involved in this as well. And it can be quite confusing over where do we start? Who do we need to talk to? So there's a bit of a framework I like to give to people here. And first and foremost, if you're in pain, if you're starting out and you have pain that's debilitating and is actually keeping you from exercising, but you know you have to start, your first port of call is your physician, right? It's very important that you go and see a physician. And when I say a physician, if we're dealing with shoulder pain, back pain, knee pain, hip pain, where any joint, we're looking for an orthopedic surgeon, right? They are trained in, is there damage to the joint that is going to get worse if I do what I would like to do? Go and see them, get an image, X-ray, MRI. So the difference between the two is the X-ray is going to show you the bony structures. Maybe it'll show you if you have arthritis, right? At a knee joint, it'll show the gap at your knee being reduced to basically nothing, right? That's really good information from an X-ray. It won't show you any of the soft tissue. So if you have a muscle strain or a ligament strain, it won't necessarily show that. And so that's where an MRI might be indicated. Like if you injure your lower back and you go get an X-ray and it really show you if you've got a herniated disc, it might show you some change in the space between your vertebrae, but it's not going to really definitively say what's wrong.
But
So
usually
MRI,
insurance has you start there.
Insurance will always have you
Yeah.
start with an X-ray before you get an MRI. Your MRI is going to give you a much more detailed image of the soft tissue. Now we can see Is there a soft tissue injury? Is there a disc injury? Is there a ligament injury? It'll really definitively tell you what's going on at that joint. From there, the physician will be able to tell you this is a surgical intervention. Most good orthopedic surgeons nowadays will say, let's try conservative management first. And if that doesn't work, we'll look at surgery. Mm-hmm. Now, conservative management means your next port of call is a physical therapist. Mm-hmm. So your physio is there to guide you through that very early stage of the process. Their key skill set is taking you from pain to getting you out of pain. That's really the window that they cover and are highly expert at it. So you want someone with a doctor of physical therapy, potentially an OCS certification, really great things to look for in a practitioner. And they'll generally have a specialty. So you'll call down to the clinic and you say, hey, I want to see your best ankle rehabber. Mm-hmm. Each person will sort of have picked a region and they'll get really good at it. Mm-hmm. Your PT is going to guide you through some really low-level rehab-based reconditioning exercises that bring your level from pain to reduced or out of pain. An absence of symptoms does not mean that you're prepared for your sport. What it means is that you're ready for the next step. Mm-hmm. Mm-hmm. Now we know you can move on to your personal trainer, your strength and conditioning coach, and you can start the journey of the next step of preparing for the demands of the sport you want to participate in. This is going to bridge that gap between rehab and performance. And it's a critical piece. And we did a podcast on this with Brian Wolfe. Mm-hmm. That was about how we make decisions around this piece of the puzzle. And it's such a critical one.
And so just to clarify too, when you're talking about the gap from rehab to performance, essentially you're talking about from where you are, if you've just left rehab, to performance where you want to be.
Yes.
To do whatever the activity is. And if that's, correct, you've had back pain, you're out of back pain, but you still need to sit 8 hours a day and not get up from your desk or whatever, there's still a gap there.
Absolutely. Mm-hmm. And that will be fleeting because as soon as you stop, mm-hmm, you'll regress. Mm-hmm. So we have to keep progressing to make that lasting change, and that will have to stay a part of your program. So if we went from you were here, you saw your doc, you got a little better, you saw your PT, you got a little better, you're still trying to get to here. Mm-hmm. You're trying to play pickleball, or you're trying to swing a golf club or sit at your desk for 8 hours. So now you're further along your journey and you've done a wonderful job. Now there's just some more steps to take. Mm-hmm. And you want to be selecting somebody who is experienced, somebody who is experienced in the problem you are trying to solve. Has this person taken somebody from having back pain to playing the sport you want to play, or a sport? There are several different certifications out there. National Academy of Sports Medicine, or NASM, mm-hmm, do a great job. They have a corrective exercise specialist certification. They have a performance specialist certification, personal training. Somebody with those three will do a really good job of taking you from the rehab setting to the performance setting. Mm-hmm. There'll be people out there with undergrad, masters, someone like myself with a PhD, 20 plus years of experience. We're going to be able to do a little bit more of that spectrum. Mm-hmm. But I'm not an MD, mm-hmm, right? You're not going to come to me in debilitating pain and I'm like, yeah, sure, you can do this. Right? That's not my call. Mm-hmm. Right? We start with the doc and we get our guidelines, our marching orders in that early phase, whether it's a PT or someone like myself. We'll get our marching orders from the physician. We'll take it slow and then we'll keep going. I'm also not a PT, and so I work hand in hand with a physical therapist, a chiropractor, if that other professional for my clients, so that I know what I'm doing is not going to set them back. right? So it takes that full spectrum. And I look at everybody working together on a spectrum with a different skill set, and where do we work with them, right? Where do you need to be? If you're not in pain, wonderful. Let's start with a really good personal trainer and work our way up.
Mm-hmm.
If you're in a little bit of pain, just a little nagging pain, start with the physical therapist.
Mm-hmm.
Don't necessarily need to go to your doctor. And so there's just a decision tree for people on how you're currently presenting and what the next steps are in terms of getting you along the path that you want to be going on.
And I know that you see these certifications you've given as a guideline, but really it comes down to the experience that the person has in the problem that you're trying to solve.
Yeah.
Yeah.
Yeah. Those are the entry level pieces. Mm-hmm. That shows a level of education and competence. Now experience, I think, is really important. You know, have they actually done it?
We call ourselves Vitality Collective. Explain what the collective is.
Yeah. So Vitality Collective, what is vitality? Well, it's living the life you want to live, mm-hmm. right? That's your vitality. Mm-hmm. Collective is no one of us has all the answers, right? So our collective, we have our clients, they're a part of the collective. They are their own collective, but we also have our practitioners that surround mm-hmm. us, right? That's our collective. It was the same in sport. It's not the athletic trainer. It's not the physical therapist. It's not the strength coach, the data scientist who have the answer. It's all of us. We are force multipliers for one another. And we should all be involved to a greater or lesser extent, depending on where the athlete lies along that spectrum. No one's ever not involved. Our physicians were always up to date with where everybody stood regarding their health. They were always involved. But they weren't necessarily involved day to day as they would have been with a guy who's 5 days out of ACL surgery, right? So we have to understand what our collective is. Where does our skill set start and stop? That requires your self-awareness to be a part of this collective and humility. And I think that's something you should be looking for as somebody who is seeking a professional to help them on this journey. Humility is a very, very large piece of that puzzle. Just like the advice we're looking out for, how certain are you? Like if this person can solve all of your problems, I'm going to say they're not your person. The guru. Yeah. If they can't name a single other practitioner in the town that they've lived in for 30 years that could also be a complementary care partner in this, maybe look elsewhere.
Yeah. And we've seen this a lot. People that need help beyond just the person that they're seeing, mm-hmm. and they're actively discouraged from seeing other practitioners that might have a complementary or a different skill set. So I think it would be fun to talk about case study. And osteoporosis is a big one. A lot of women have sort of done the Jane Fonda workouts that they were told to eat and train to be thin. Mm-hmm. And then they've done this for years, been dedicated for years and been healthy. But one thing that they've missed is bone density. And I think mm-hmm. a lot of women feel let down, betrayed, angry, frustrated, that now they're in this position to deal with osteoporosis. But it is something that can be addressed. Can you take us through that?
Yeah, I'm first of all, stay tuned because coming up, we've got an unbelievable interview coming up with Dr. Belinda Beck on bone density. So we're going to do a really deep dive on this topic. Mm-hmm. But it's an issue that we have to deal with a ton. Mm-hmm. Going back to misconceptions mm-hmm. about bone density, training, and the cost benefit of the training modalities that will impact bone density versus their risk of harm. Mm-hmm. Right. And so this is where a lot of the advice that's coming out now, again, based on new research, so absolutely does impact bone density, but people are being told jump training, right? What's one thing that women can do today to improve their bone density? And what they're being told is jump training. Jump training is something that is incredibly high risk, right? We would have to keep plyometric training, that's what we're talking about, in our NHL players' programs, because several times, they're in a season, they're locked in a boot, right? So that Achilles doesn't get a lot of training load. So several times, athletes would leave their team, go back to their trainer at home, do plyometrics, jump training, day one of their program in the off season, and rupture an Achilles. So is it important? Yes. Should we do it right now to start? Absolutely not. So we've had a number of people come to us, and this is women in their 80s. They've got osteoporosis. The initial temptation is, well, what do we have to do to increase bone density? Lift heavy, right? You put a lot of load through bones, multiple directions, and it will adapt. It's just like the muscle. It just moves slower, right? So the muscle pulls on the bone and it stimulates the bone to get stronger. So we can start there, and we can add jump training, and we know that that will impact bone density. But as we said, we lift heavy, 3 to 5 rep range. We start jumping right away. We can actually cause injury. So in this particular case study, 82-year-old woman, we start working out. She has a ton of shoulder pain, chronic shoulder pain on one side, previous injury, fractured humerus. She has chronic high hamstring pain from a variety of factors. Pretty small, like 100-pound total body weight. And so
absolute beast, though.
Yes. And determined and has trained her whole life, but has a very small physique and has seen a decrease in bone density throughout her adult life, to where she's pretty serious osteoporosis. So the first thing we've got to do is identify where she's at. We know what the goal is. She wants to stay active. She wants to be able to walk and do everything she wants to do. We have to avoid hip fracture, right? And so if we can avoid fracture, we know we extend her life just by an order of magnitude. Like it's so much different between fracturing your hip and not. So we've got that as our overarching goal, but where she's at is in pain, unable to do certain movements without pain. And so the first spin of the cycle is, let's get her out of pain. Now, this was one of those where she's used to a certain style of training. She'd been doing more than I was giving her. And for 2 months, she's like, Jeremy, I'm used to working harder than this. I don't think we're doing enough. And it's like, okay, but does that hurt? Yes. Okay, then we're not going to do it, right? So what we had to do was get her out of these pain patterns in the shoulder and the hamstring first. Now, we worked alongside a physical therapist to help with that. But this was not me saying, I will fix this for you. I don't have the manual skill set. So myself and her physical therapist communicate regularly, and we work together on these pain sites. And if I'm unsure, I'll send him a text. Hey, what do you think about this? And, yeah, sure, you can do that. Maybe with this modification. Great. And I'll let him know how it goes. And he'll do a session and he'll let me know how it goes and what he sees and what he thinks would be beneficial in the program. So that was number one. From there, that was probably 2 training cycles, probably about 8 weeks per training cycle. Right, so we've got a decent chunk of time just unwinding an injury history and building some foundational strength. Then we start a performance training. We've laid the foundation to be able to start building some different strength patterns. So we start deadlifting, but we start probably below her capacity. We start at about 12 reps, and We start working on form and making sure she's pain-free. And slowly over the next 4 or 5 months, we gradually increase that. We build in some new movement patterns. We build in some different strengthening exercises. I would say 6 months into her program, we start the initial phases of her jump training. Mm-hmm. But at this phase, we weren't even jumping. We were actually landing, right? Because that's when we take the biggest impact forces, and we need to be able to put the brakes on with our muscles and not stop with a really rigid set of muscles and all that force transfers to the joints. So we actually started with what we call snap downs. So just standing tall and dropping down into a squat as quick as you can. Your feet may even come off the ground. And then you put the brakes on. So we start building your capacity to land. Did that 2 feet for about 8 weeks. Then we did it on 1 foot. Then we progressed to actually jumping off a box and soft landings. Then we started doing some squat jumps. So she would just squat down, jump as high as she can, land. So we start jump training. Then we start doing some long jumps. So how can we jump for distance? How far can we go? Then we start doing some single leg, some split squat jumps and jumping and switching legs. So this was a progression that didn't start for 5 months and then very slowly built over the next 4 months. But after about 9 months of training, she was due for her next DEXA scan. And we were actually able to see a 3% increase when the expected is a 2% decrease. We got a 3% increase in bone mineral density at her spine. What we also saw in one of her hips was a 5% increase in bone density. Now, coupled with the fact that we had been deliberately working on fall prevention, so how could we, in the case of a trip, educate her nervous system to be able to lift her leg, get it out in front of her, and put the brakes on so that she didn't fall? We did both. We reduced her risk of falling, which was huge, and we increased her bone density. Right? And this is in an 82-year-old woman. So it can be done. And it's very important that that's got to be the first part of your mindset, and you can do this. But don't think you can start deadlifting 50% of your body weight and doing plyometrics, which is where she is now. You have to start down here and view this as a long-term change to build the conditions so you don't cause an injury. Because starting with large absolute weights, we can actually cause fracture. The soft tissue can get injured because it's not used to that quick, the high loads and also the quick turnaround. So we can cause injury if we start too far up the intensity spectrum. We have to start down here. And even though we're now here with this client, her physical therapist is involved every week. Number of times, so do I still need to do this? Absolutely you do, right? So we're all involved in her care, but we're gradually building her into a more robust, less fragile version of herself, and her confidence has gone through the roof. Now, we've talked about this example a few times where one of the key moments for her in recognizing the progress she'd made was walking along the street in Manhattan, and she tripped on a crack in the pavement. And she got her leg out from under her. She got it on the ground. She caught herself, didn't fall. And her daughter, who trains with us, is like, there's the training. That's exactly what we worked on. So there's so many facets to this. How you build somebody through that spectrum truly is how you prevent injury, right? It doesn't happen overnight. It doesn't happen in 4 weeks. Spend a lifetime building these patterns. People spend months, decades even, declining. And so how do we then think we're going to dig them out of that hole in 4 weeks when we start our specific paddle tennis training program, right? I think that's the key to this, how we sort of swing them back out of that hole.
Yeah, and I think I'd like to point out a few things. One is, again, coming back to working with someone, like you see all these sound bites on social, jump training. Okay. So now we know you shouldn't just, if you're not already doing it, you shouldn't just jump right in. No pun intended. So find someone that has experience and has taken people through these processes before. So we've talked about how you can have different goals for your body, different goals for your training, but principles are the same. Can you just talk me through some of the principles that are the same?
Yeah. So I saw this a lot. I went through NCAA with, how many teams did we have? Like 19, 450 athletes. Then went to NBA, NHL, Major League Soccer, been in rugby previously. The thing that transcends all sports is that they all think they're super unique, right? Their sport is so different. And, I don't know, you're not from our sport, you won't understand. Look, while the rules of the game themselves are very unique across sports, and they place unique demands. Basketball is almost entirely vertical. There's some lateral and backwards. If you take hockey, there isn't a single vertical action that happens. Any movement you do upwards, you go nowhere. So starting, stopping, accelerating, changing direction, everything has to be done laterally, pushing against the ice. So there are specific demands of the sport. But if we come back to the first order principles of what creates that movement. So triple extension at the ankle, knee, and hip. If we train that motor pattern as the predominant training stimulus, then the athlete will become very, very powerful in their sport. It will translate as they practice and play their sport. Strength, power, mobility, across the board, these are absolutely necessary. Cognitive abilities, fueling. These are just the baseline principles of preparing an athlete. I'll refer back to the episode that we did with Ramsey Nijem. Ramsey was telling us a story about he felt really bad because he had this guy come to observe a training session, drove 9 hours to Kansas basketball, right, to observe one of the best trainers in the game training their athletes. What he had him doing was a basic tempo goblet squat that day. Right. So super underwhelming for someone, because you think you're going to go in and see this super fancy basketball specific training. And that was basketball specific training. Right. That's the lesson that guy who came in to observe the session needed to see. He needed to see that athletes prepare these foundational movements and build foundational strength, power, mobility through basically the same stuff. It would probably have looked a lot similar, very similar to if you'd walked in to watch the Maple Leafs preparing. Right? Similar sort of stuff, goblet squats, jumps. Like nothing that's like this training for elite hockey. I saw a post on Instagram. There's a guy with an account who does all of these different sports. Which sport should I do next? And here's training for elite rugby. Here's training for elite hockey. And you watch it and you're like, wow, that's super impressive. That looks just like hockey. That's not how you train hockey players, right? We might have done a couple of those movements, but they were nowhere near the top 90% of our exercise selections, right? Once we'd gone through the foundational levels, maybe we'd have done one of those in a cycle, but you don't have to have your training look like your sport. By and large, there will be some elements of sport-specific training in the weight room, but mostly it's guys just getting strong and being able to move in multiple planes of motion.
So there's a lot of noise out there, and there's influencers who put out some really clickable sound bites, and it confuses people. So I'll just give you a few examples, and maybe you can walk us through these and help us make sense of them. Women should lift heavy. Women shouldn't lift heavy. Uh, you shouldn't run a marathon for longevity because of the inflammation in your body. Can you
Mhm.
just talk about some of those?
Yeah, there's so much stuff out there with women's training right now. First of all, I'm super, super glad that there's a lot of awareness being brought to women's unique needs in the health and fitness realm, because there are certainly gaps in the research. But UCSV, we had 500 athletes. Half of those were females. We didn't have a lot of technology. We didn't do a lot of fancy monitoring. We just understood why females are at higher risk of ACL injuries, as one example. Again, it's understanding the demands and the risk factors. And so, yes, there are some specific needs. No, they are not so different to the guy's training. The mechanism of an ACL injury is the same. It's where the knee falls in. So you get a valgus stress on the knee where it drops in across the line of your body, and your hamstrings don't decelerate your knee sliding forward. So you get some sort of inward force, some rotation, and your knee slides forward. And that's how everybody tears their ACL. Everybody, right? In a non-contact scenario. The difference between men and women, men's femurs sit straighter because they have narrower hips. Women have a larger Q angle. Now, the Q angle is the angle from the hip to the knee. So because of a broader pelvis, women have a greater Q angle. Already, they're sitting in some valgus stress. And so it's much easier for them to get into the mechanism of an ACL tear. Yes, there might be some other peripheral factors. Yes, there might be some hormonal factors. Phases of the cycle when you're more susceptible. Maybe there are. We didn't measure or monitor any of that. In 3 years, we didn't have a single ACL tear in 200 plus female athletes per year. What we did with our female athletes was put extra emphasis on strengthening them out of that injury mechanism. We put extra strengthening onto the glutes that prevent valgus at the knee, extra into the hamstrings and the quads to make sure that they had a shock absorption system for that knee. Quads could decelerate them. The hamstring could stop the forward slide of the femur over the tibia. And we were able to prevent all of those injuries. Not a single major surgery in any of our athletes during that period. So as a female, when you're approaching training, you just have to train. Don't be so worried about all of this small stuff. Like don't train fasted. Right? Your cortisol and you're this and you're that. Like we had female athletes coming to the gym at 5 a.m. They hadn't eaten breakfast. They all adapted. They were super strong. And in fact, there isn't really a ton of research, if any, that I've found that shows any difference between fasted versus non-fasted training in terms of outcomes for fat loss, for muscle gain, for bone density. Any of the major outcomes you'd be in the gym for, despite just it being healthy for your whole body just to be in the gym and be moving. If you don't like eating before the gym, don't eat before the gym. Eat after. As long as you're within a couple of hours of training, you're fine. As long as over 24 hours you eat enough protein, you are going to adapt. And that's it. There really won't be a difference in your outcome. So the female training noise is probably the loudest right now.
Yeah.
And there's some very, very big popular podcasts pumping out this information. And so it's where we've got to hang on, pump the brakes a little bit. The evidence doesn't support any of these statements. And yes, you can train hard. Yes, you can work hard. Yes, you can get results in most conditions. The other thing that you sort of talked about was with regards to lifting heavy. I think this principle is more around, and this is men or women, it's around effort. And lifting heavy is relative. there's a rep range that will cause an adaptation basically from 3 to 30. So if you do 3 reps of an exercise and it's very, very difficult, or if you do 30 reps of an exercise and it's very, very difficult, you're probably going to adapt, right? So why would we choose one over the other? If we think back to the principles of getting injured, 3 reps and maybe I could do 4, but I'm going to stop at 3. That's a lot of absolute weight, right? You're going to have to lift very heavy weight. All of your joints and tissues might not be prepared for that much force. And so there's higher risk of injury when we talk about heavy lifting with regards to a 3 to 5 rep range versus the absolute load that you can lift for 30 reps is going to offer much lower risk of injury. And it's going to be closer towards the endurance phase of things. So where I like to live is you want to be at about an 8 out of 10, which means I'm stopping here, but if I had to keep going, I could probably do 2 more. And we sit at around 12 reps for most movements that we do, particularly with people 50s, 60s, 70s, 80s. Because I think it gives us enough of a load stimulus in terms of weight lifted, physical weight, but also minimizes the risk of being down here lifting super heavy.
The sound bites right now with women and working out and what they're eating and their cycles and all of these things. And it's like, yes, women are not small men, but they are also human.
Yes, they're not large mice either.
Right. So there are things that we know about women, and we don't have to sort of throw the baby out with the bathwater and start all over. Like, oh, we don't know how to train women. Well, we do. I mean, you and I have trained. Yeah, we do. You and I have trained together for over 20 years now, and I've done very well. And I recently, a couple of years ago, got really sidetracked by all the noise and I have some GI issues, and I prefer to lift weights without food in my stomach. I feel better. My body feels better. And then, I got really wrapped up in you should eat protein before you work out, or else why did you even work out? And
well, that was literally the message, right?
Yeah.
That was the soundbite in one of the biggest podcasts in the world.
Right.
Was an expert and a researcher coming on and saying, when I work with female athletes, if they didn't eat protein, I ask them, why did you even go to the gym? And so what you're saying to me is if I didn't follow this very precise protocol that was very effective in training mice, right? Female mice, not women, then you wasted your time getting up, going to the gym, working your ass off, lifting weights. There was no benefit, right? But that's what sells. That's what'll get a click, right? So I think we've got to be very careful with that, because you're an experienced lifter, you're an experienced exerciser, and it threw you off. So imagine now you're just starting your journey. Right now, that's a really challenging message, and it's difficult. How do you filter that? Someone with a PhD, a director of sports science from a major national governing body, Sports Science Center. How do you? And
it's making its rounds on social, and everybody's liking and reposting, and it's like, well, okay, well maybe I'm doing it wrong.
Yeah.
Even though, like, I didn't look at myself and look at the evidence that I have for myself. Wait a minute. I'm doing okay here.
Exactly. This is working for me. How I'm training is producing the results that I wanted to produce. Right.
Yeah. So I think that's sort of, you and I have talked about this before, but that's sort of one of our principles. Like, we now check in with ourselves first, and if it ain't broke, don't fix it.
Right. Well, and that is the first place to check in. We're constantly incorporating new knowledge into our training cycles and our programs. But I think the really important thing that we're trusting more and more is our evidence, right? That N of one study of this is working for me. Should I change it? Right. And I think we've got to look at the source of where this is coming from. And that can be difficult, as I said, like when it's coming from a PhD who's a researcher. But the number one filter for me is this person saying do this or nothing, essentially? Right? This is the way to do it. How absolute are they in their messaging? If they are really certain, really absolute, I'm not buying.
Yeah.
There's too many ways to do this. Human beings have evolved and survived in so many different environments over the years and been able to perform really well in so many different conditions. There can't just be one way to do it. There can't be.
And
So
the body's adaptable.
Of course it is.
Yeah.
It adapts to the stimulus you put in front of it. And so we have to use that as the first layer of filter. And then beyond the credentials, we have to look at, has this person actually solved the problem that they're speaking about with a lot of people? Right? Not like the 20 people that were in their research group. Have they gone into the world and coached this and produced great results with a wide variety of people? Just athletes who are pretty genetically gifted. Have you gone into the world? If you're going to give this advice to every woman, have you had a broad spectrum of women that you have applied that to? Because the psychological nuance as well of coaching is such a major part of this. Like I know you, if I coach you and it's super negative like that, like, why'd you even go to the gym? You'll stop going to the gym.
I did.
Right.
I did, because I couldn't get my protein in before the gym. I'm like, oh, well, that's a waste of time.
Yeah.
And how long did it take you to sort of talk me out of that cycle? I would like to talk about the coaching piece, because I think it's great, the research. And yes, we are always on board with more research, especially more research with women. Like, yes, research, but there needs to be the integration. And that's where the coaching piece comes in. And that's where I see that you're so much different from a lot of people, in that you can take the perfect protocol and help people make it perfect for them. Because you and I have talked about this. It's not the perfect protocol if it doesn't fit in your life.
Right. Yeah. And that's really the experience of pro sport. Pro sport is the best bad way of doing everything. Right? You think it's just high performance. It's all we're focused on. Well, no, because we finished playing in New York at 11:30 at night, flew to New Orleans, got in at 5 in the morning, had a video meeting at 9, 10, and then played again at 7:30. So where's your perfect sleep protocol now? Like, we can't be paralyzed by our circumstances. We have to, okay, if you've got 4 5-minute windows throughout the day, we have to find you a way to use them. We can't just say, well, that's useless. You need to give me an hour. You got to find an hour. You got to prioritize. Well, I'm sorry, I'm building an empire right now. I've literally had this conversation. Like, guys that are literally building empires in the business world. And that was how much time that he could give you. So what are you going to do? Like, tell him, no, come back when you're serious about it. Or should we start? And you take, okay, what are the principles that you can put into 5 minutes and get him something, get him some stimulus to start the process? How much impact you can have with 4 5-minute windows through the day on your metabolic health? That has to be better for him than, well, no, actually you need 16 work sets on each muscle group twice a week in order to create optimal hypertrophy adaptation. Well, what's that bullshit? Like, you can't you can't do that and have a job.
Yeah, I'd like to sort of bring up an example that you and I have from our life. My mom, this has been
Hmm.
probably 10 years or more ago, she wanted to start training. And so we got her in. She doesn't live in the same city. So we got her in with a trainer at the YMCA. And she was, at the time, she was probably, let's say, early 70s. And she just needed to move. And
Hmm.
so she shows up at the gym, and a new trainer buries her in a workout. She never went back. And she's struggled with health. And even just walking, perhaps if that trainer had just met her and walked around the track with her twice a week, she would have had a very different outcome.
Hmm.
And so we have a lot of fitness professionals that do tune in. And so if
Yeah.
there's a young one that's listening that you could sort of mentor quickly, what would you say to them?
Look, I get it. You want to show value,
Mhm.
right? I still feel that. You want to show value to your clients. Like they're going to be like, whoa, this guy knows what he's doing. I feel that especially early on with my clients, we start at a very low level. And I feel them a couple weeks in starting to be like, we're not really training yet. Like I basically don't take clients on who just want to, can I try it for a month? Well, no, because you're not really going to get anything out of it. You've got to resist the pressure and resist your own temptations to try and prove yourself. What we're trying to do is prove ourselves over the long run. Can you create change in a person's life? And to do that, we take the where they are and where they want to go. We can't start here. We got to start here. Where are they now? Most people are like, oh, you're in pain and you want to play golf. Okay, well, golf's a rotational sport. Let's start doing some rotational cable work. They're not there yet, right? And so you'll get them 2, 3, 4 weeks in, the pain will go up and you'll lose them. So now they haven't gone anywhere. You know, talking about your mom, that would have changed the trajectory of her life. I don't think you'll mind me saying. As a result, she's continued to live a pretty sedentary life, which has opened the door for other health complications to sneak in, right? And so we massively underrate the long-term effect of what we can do and overvalue the short-term impact we can have. Nobody ever got in shape in a month. So true confidence in your abilities is to resist the pressure internally and externally to prove you know more. True confidence is this is enough for right now. I know this doesn't look like what other trainers might have done with you, but we'll get there. This is enough right now. We have to prepare these foundational elements so that we can move on and get you long-term benefit. We're not trying to get you in shape in 4 weeks. And this is not your summer abs program. This is your longevity program. It's not just where are you from a physical standpoint. It's also a mental, emotional standpoint. We have to understand what are the limiting factors in any change that we're trying to make and understand it's going to be a very slow process. People will change one thing at a time and they won't change it a lot. There'll be a little bit. And if we can stick with them, not put too much pressure on it, they'll take steps. Those steps will be compounding over time. They'll start seeing results and they'll want to accelerate that themselves. And so we just got to hang in there with people in those early stages and not try and move the needle too fast.
And it's frustrating, right? Like, I mean, personally, I would like to talk about this a little bit. We've started our business, a year and a half ago. I mean, being an entrepreneur, I grew up in an entrepreneurial family, and so I worked in the business and I knew it was a lot of work, but man, the responsibility when you are the owner, I mean, literally, you and I have been like sun up to sundown and beyond 7 days a week for a year and a half.
Right.
And it's only recently that we've really been able to get all of our habits dialed back in. And I think we were both surprised how quickly we we got out of our good habits just because we were heads down working. And it's given us a lot of empathy for these titans of industry that are building empires. And they're like, hey, buddy, you've got 20 minutes a day. You've got 5 minutes here, 5 minutes there, 5 minutes there. But we've lived it now. And we've also seen that those 5 minutes a day here and there make a massive difference.
Yeah, just in rebuilding your habits back in. So yeah, I think we've been guilty of that, thinking that we can go from 0 to 100 when we've had disruption at any point in our lives. And we've tried to go, all right, diet's fixed, right, what we know we're supposed to do, exercise programs, right back to where it was, and have not been able to maintain that. I think the change happened slowly on the descent, and it has to be slow on the way back up so we can build our habit base back up. And I think that's a really important point.
Before we go on, let's just back up to the inflammation soundbite that we talked about. Recently, we heard someone say you shouldn't be running marathons for longevity because of the inflammation, and you broke that down for me. Can you tell us here about that?
Yeah, so it was actually quite a good clip from an interview, and what he was saying was you don't need to lift heavy weights. You don't need to do this vigorous training. You don't need to train for ultra marathons and marathons and all these real high intensity things. That is correct. You don't need to, as we've alluded to. But we mustn't steer people away from what they're currently doing. The activities you enjoy doing are the ones that will keep you alive. Right? That's your social community. That's your physical activity. And one of the nuggets he just sort of threw in there was that actually it might shorten your life because it increases inflammation. Well, yeah, any exercise you do increases inflammation, but it is a transient and adaptive inflammation. This is not a chronic inflammation that is going to impact your brain health and your heart health and all these other factors. We've literally caused damage to the tissue that creates an inflammatory immune response so that we can heal the tissue and upregulate its capacity, right? So it's a necessary side effect of adapting to a training stimulus. If that's what you're already doing, keep doing it. Great. But for your mom, we're not thinking like, you know what would be great for you? You should train for an ultra marathon. Well, of course she's not going to stick to that. And that was his point, was don't start there. You're not going to stick to it. Like 20% of Americans stick to a regular routine, I think was his point. So don't start with that. You don't have to start there. 100% you don't. Do not start with ultra marathons. I've actually, for the first time in 20 years, started a running program. It's so hard. And I was actually quite a good runner when I was younger. Right. So, yeah, I get it. Don't stop what you're currently doing and enjoying because you hear a soundbite on Instagram.
And if people haven't trained in the gym for their whole life, or maybe it's a different type of training they haven't done before, they can get really confused. And there's some places that have this special equipment that's essentially it's a high load on the bone, right? That maybe they aren't prepared for. Can you just speak to that a little bit?
Yeah, absolutely. And I think, again, it's knowing the science, knowing the research, and being able to apply it appropriately. Mm-hmm. So there's OsteoStrong programs. There's a number of these programs where you go in and use these machines. And what this machine does, it's sort of an overcoming eccentric machine. So it figures out how hard you can push against the machine. And you push as hard as you can, and it pushes just a little bit harder. Right? And you've got to slowly let that machine come towards you. So it's a maximal eccentric contraction. That's in the research as an effective way to increase bone density. Right. No question. However, if you have severe osteoporosis, your muscles are capable of producing force that is more than your bones can take. And so what you risk there is actually an avulsion fracture of the bone, where you actually pull a chunk, where the muscle attaches, you pull a chunk of the bone away and detach the muscle from the bone. There's also compression fractures that can happen. So under those really high loads, we can actually see vertebrae and other areas suffer a compression fracture. And so we've got to be very careful, because a lot of people can produce force that their bones just can't take. Now, you have no way of knowing that. If they don't come in with the DEXA that says, okay, maybe some osteopenia, maybe you're just low on the normal range, where that might be appropriate, you are very, very, very much increasing risk the more severe you get into osteoporosis. So we're getting into that intensity spectrum where you're causing harm. So that there's another thing that's been discovered recently in the research, that is root fiber atrophy, where if we take specifically in our elderly population, we suddenly start with that intensity of training, we can actually damage the nerve fibers. When we damage the nerve that feeds a group of neurons, each nerve will branch off and fire a certain amount of neurons. What will happen is that nerve will die, and these will start to atrophy because they're just not getting stimulated. While that nerve builds back, we're not getting any stimulus to the muscle, so we actually see damage, and we actually see the fibers atrophy, which is the opposite, obviously, of what we're going for. So again, we have to pick a rep range that's not going to put too much absolute force on the muscle. It has to be within a range that you can handle. And we have to be very delicate about what's a person's training age. So how much training have they done throughout their life, and start them appropriately, and build them over time with a view to a months and years long program, and not a weeks long program where, okay, yeah, we'll get you a 6-pack for the summer.
Yeah. And I think, like, we never want to discourage people from movement. But again, it's zooming out those types of places, like where's the cardiovascular benefit in that? And that's something to consider.
Yeah, there's, again, sitting on a machine, moving in one plane of motion, great. Love that you're training. But there's so much more that goes into training for a complex environment. You know, if you're training for your sport, it's multi-directional. It's different speeds, it's different capacities. It is cardiovascular, right? So how are we putting demands on all of these systems within our program? That can be a part of your program if it's appropriate for you. It can't be your whole program. And again, anyone that tells you this is the only thing you need to do, we don't trust that person.
Yeah. Yeah, absolutely. And it comes back to doing what you love too. Activities that you love to do.
Right. Exactly.
Well, Jeremy, we've talked for a while here, and this has been fun. This is sort of a lot of what we do on the side, is talk about these things, and we always find it really fun. Glad that we could share it. Jeremy, what are 3 takeaways from today's conversation?
Well, so number 1, understand where you are relative to what you want to be able to do. Always understand that you don't play sport to get in shape. You get in shape to play sport. Yes, go out and play pickle, but understand that there's going to be an element of preparation to get you in shape to do that. What it basically means is you have to be conditioned, increase your capacity to be able to withstand the sport and not get hurt playing it. Remember, we're about avoiding fragility, which means do not get injured. Don't wrap yourself in bubble wrap so you don't get injured. Prepare to become robust and resilient. Okay, so that's number 1. Number 2, don't push through pain, right? If you're understanding where you are on that spectrum and you are in pain, get it checked out. It does nothing for you long term to push through that pain. Understand if that pain is going to make something worse. It's there for a reason. You need to understand it, right? So go see your doc, go see an orthopedic specialist, go see an orthopedic physical therapist, and work through that pain before you get to a hardcore training program or playing the sport. And so as you're working through that pain, as you're working with your doc, with your PT, when you first start working around that area, we can see a little bit of an increase in symptoms initially. You don't have to worry so much about that. You know you're working within a safe range. Everything's just getting a little sore from your training. So long as that doesn't keep getting worse and it stays around a 3 out of 10, you're probably in a safe zone. So you can keep moving forward. Within about 4 weeks, that should subside and you should be on to pain-free training. So don't worry if there's a little bit of pain as you start at the appropriate level. Shouldn't be above a 3 out of 10 though. Number 3 for me is keep going. Just move. Do the things you love to do. It's going to put you around the people that you enjoy being around. You'll have a community. You will be active. You'll be moving your body. Prepare for that movement. Train hard and become robust and resilient. You can transform your body and get the outcomes that you want at any stage of life, at any level. You can adapt. You will improve. It will not only improve your longevity, it will improve your quality of life. Avoiding frailty and becoming robust and resilient will add so much joy to your life, and you get to experience yourself getting better with age, which is the exact opposite of what we're told. So those would be my 3.
Thank you. I've really enjoyed the conversation.
Yeah, me too. Thanks for joining me, and thanks for asking the questions today.
What a great conversation between Michelle and I on avoiding frailty. Here are the 3 key takeaways from today's episode. Number 1, understand where you are relative to what you want to be able to do. In other words, assess your current capacity honestly so that you can train towards the demands you'll face without setting yourself up for injury. Number 2, don't push through pain. Pain is a signal, not a challenge. Address it early so that you can make lasting progress instead of creating setbacks. Number 3, keep going. Just move and do the things you love to do. Staying active in ways you enjoy builds both physical resilience and a strong community around you. If today's conversation resonated with you and you're ready to apply these concepts into your own life, that's exactly what we do at Vitality Collective. We bring together world-class diagnostics, personalized planning, and ongoing performance coaching to help you build a life of sustained vitality. Head over to www.vitality-collective.com to learn more. And if you enjoyed this episode, I'd love to ask you a quick favor. Follow the show, rate it, and write a review. It really helps us reach more people who can benefit from these conversations. You can also go ahead and share this episode with someone that you think would enjoy it. And be sure to follow us on social for more. On Instagram @Vitality Collective Performance and on LinkedIn @Vitality Collective. Thanks for listening, and we'll see you next time.